external application series, the theoretical portion of external application. Let's begin. Now we will understand what is the evolution of Hahnemann thought with the change in the edition 6th. An interesting development occurred in the 6th edition of Organon. Hahnemann view became more flexible. Rather than completely rejecting external application, he acknowledged circumstances in which they could be beneficial. I repeat, he acknowledged those circumstances in which it could be beneficial, like a specific condition. And this shift demonstrates the scientific spirit of Hahnemann, who was willing to modify his views based on observation and experience. Now you can see that there is no stubbornness in Hahnemann in changing his perspective. If he get evidence, if he get observation and experience, that yes, it works like this. Now coming to the aphorism, next aphorism. Now what are the risks of external application? If this protective outlet, which was saying that hello, I need treatment, is forcibly removed through topical measure, the internal disease, what it will do now? It will awaken with greater intensity. It will get angry. Okay, I gave indication, you're not treating me. You treated that indication, but not me. So according to this theory, that is suppression can drive disease toward deeper and more vital organ, which previously the mind was trying and the body was trying to elevate itself by expressing it out from the center to the periphery. Now it is coming back from the periphery to the center. This idea forms the basis of his strong opposition to suppressive treatment and his emphasis on constitution prescribing. In this aphorism, Hahnemann is trying to remind us that human body is not divided into different components, different parts. If you say the skin, the respiratory organ, like you have read in your physiology chapters or other things, the skin system, the respiratory system, the digestive system, the renal system, they are not something which are divided, they are connected to vital force. Therefore, medicinal influence is not limited to a tablet placed on the tongue or injection being given on the vein. It is through several pathways. These are all connected to each other. So this has a significant observation because it opened a possibility of using medicinal substance in a more dynamic manner. What is important here is that Hahnemann is discussing the capacity of organism to respond to medicinal stimuli, not merely local treatment of a disease. The emphasis shift from location of application to the reaction of the whole organism. Now, how does the living organism respond to the medicine? This is the main question you need to ask, how when after giving medicine rather than where the medicine was applied. So this is what the shift is in aphorism number 284. So aphorism number 284 states about various route of administration of medicine, which we call as pharmaconomy. Now here is something interesting. For many aphorisms, Hahnemann warned us about the dangers of external application. But in 285, we see more practical and flexible approach. He suggests that in long-standing condition like chronic disease, the same remedy being given internally may also be applied on healthy areas of the skin to support its action. The important part is that this is not a local treatment. The goal is not to remove a symptom, but to strengthen the action of remedy on the whole organism. It is to be used as a route of administration rather than applying it, suppressing it. This also helps explain some remarkable cures reported after medicinal baths. It is being mentioned in aphorism 285, bath, where the medicinal substance happened to be similar to the patient disease. And remember, this idea appeared only in the 6th edition of Organon, showing how Hahnemann's thinking continued to evolve with experience. One line which summarizes aphorism 285, the remedy may enter through the skin, but the cure still belongs to the whole patient. As earlier he said, there are certain diseases, specific condition where you have to give external application. In 285 aphorism, it is not there in say, fifth edition, only in sixth edition. He gave an example of figwort. Figwort is the primary stage of miasmatic disorder. It requires both an external and internal remedy. That example is being given by Hahnemann in his book of Organon of Medicine. So what we learned today, that Hahnemann view on external application evolved from where to where, from caution to selective acceptance. And it emphasizes that true cure lies in treating the patient as a whole while using external applications judicially when indicated.